My name is Dr. Bharti Seth. I am a pain specialist. I've done my initial degree in anesthetics and then went on to do advanced pain training in pain management. I am an MD in anesthesia and an FFP-MRCA. Well, even as an anesthetist, my specialist interests were always acute pain management, which is pain you'll have after an injury or the pain we have after surgery. As I had my own personal encounters with pain, which wouldn't go away and which didn't have a scar to show, I started to become more interested in the effect of everyday pain on a person's life, on how they think, how they interact with others. And I wanted to find out what happens to the patient when my block wears off or when my injections wear off. So I started training in advanced pain management, and here I am. I find it very fascinating, and I find it very rewarding to be a part of a patient's journey as they learn how to have a richer life despite having pain as a part of their life. An average patient who comes to see a pain specialist would have struggled with pain on a daily basis for at least 12 to 18 months, and they would have seen between 4 to 6 specialists for the same before they'll come to see me. My biggest goal is to listen very actively to what they are saying, because I believe that the patient tells their story, and in listening to them actively, I try and assess what is the driver of pain. In the close to 30 years I've been practicing medicine, I haven't met anybody whose mind lives outside of their body. So while I am listening to the patient, I also try and understand how pain is affecting their everyday life. Uh, and my final recommendations are never just restricted to a pill, a potion, or an injection. I do emphasize on the lifestyle changes, which we do need to introduce like we would for any other chronic illness. I think it's also very important for us to as I said, listen to the patient and let them also listen to us to understand that they're not, the pain is not in their head. Unfortunately, pain doesn't come with a blood test. So a lot of times people really struggle with this, that I've got no scars to show for it. But I'm struggling with really bad pain. Am I just making it up? So it's very important during a consultation to listen and then to explain how pain can continue to be a daily presence without anything very clear to show for it. And then mutually agree upon that what would be the best strategy for them to manage their pains, including the role of the pills, the potions, the injections. Remember, persistent pain or chronic pain is different from a pain you have after an immediate injury. Just as you would not expect diabetes to be cured by taking an injection or a pill, you will need to have lifestyle changes done. You will need to be looking at what you eat, what you exercise. Similarly, pain which is present on a day-to-day basis is not just a symptom, and we need to understand that managing pain is not a compromise. That it is like any other chronic illness. Understanding how to manage your pain would be the first step towards gaining control of your life. And I hope that I succeed in helping my patients to be their own heroes, and to get back control of their lives, with pain which is more manageable and does not dictate their day to day.